I am live. Second live in 2 days. I hope this one starts far more smoothly than yesterday's. Yeah, we shall see. We shall see. Hi everyone. Thank you for joining. In just a moment, I'm going to be joined by Dr. Karacan, one of my favourite doctors from IVF Turkey. As usual, Dr. Karacan is going to be here with me for half an hour to answer all of your questions. So please do drop your questions in the comments, or you can send me a direct message. So Dr. Karacan, I have just sent you a request to join me. Please do join me. Otherwise, as usual, I have to start rambling about... here we go, hang on. Okay, I've just done it again, Dr. Karacan. Please join me, please join me. In the meantime, please do, everyone, let me know how you're doing. Who we got here? Hi Laura, hi Mel. IVF journey to baby walker, I love that. IVF Turkey requested, okay. Any minute now. Accept. One day, this is going to be, oh, so good. Karacan!
Hello, nice to see you again, Sarah.
Oh, good to see you too. Tell me, how was clinic today?
Yeah, it's busy today, but I'm happy to be with you. So try to answer all of the questions in half an hour.
Yes.
I'll do my best to help you out.
I'm going to be very strict with time today because usually I keep you way over half an hour. So I'm going to cut all the niceties out. I'm not going to tell you how much I adore you or how much we all adore you. So you'll just have to live with that.
We like you as well, so I'm very happy to be with you.
Now, I'm going to start with, I know there's some comments coming up, but I want to start with a couple of questions that were sent to me just before the live. And they're both quite similar. They're to do with egg quality, but this person is saying she's been told, I've been told I should be avoiding endocrine disruptors during IVF, such as certain cosmetics, exposure to car exhaust, pesticides, and all that kind of stuff. Is that true?
In fact, yes, it is true, but practically it seems impossible to avoid all these effects. So how can we live in a world without all these, bad effects on our health? So it's practically not possible. However, try to avoid from excessive alcohol intake and don't use some chemicals for your skin as if it's possible. And of course, smoking is a very bad habit because when you inhale a cigarette, you take more than 1,000 different chemical materials which might harm the uterus and the egg quality. So, and also diet or healthy food might help you get produce better eggs, but it's a long-term effect. So I'm not saying that you got to do it in an IVF cycle, but when you are ready to undergo an IVF cycle, you should lose weight in advance to be on a healthy diet and try to avoid these harmful such as cigarette smoking and some chemicals you don't know how they are effective on your health. That's the basic idea.
Yeah. I just want to quickly say your internet is not hugely amazing.
Okay. But you hear me, right? Do you hear me, Sarah?
I can hear you. You're going a little bit pixelated from now and then, but we're just going to crack on. We're just going to keep going because I can still hear you.
All right.
So, so in terms of products that you put on your skin then, because I had heard from people that not to put on, I can't remember what it's called now, but yes, stuff like with gosh, what is it called? Basically all natural like natural products are the best ones, right?
Okay. Yes. You prefer to use natural products rather than chemicals. And particularly, there are some drugs to use relieve some symptoms of acne symptoms. So these medications might be harmful to your general health or to eggs. So please counsel your doctor before using these medications if you are going through IVF.
Okay. I just want to check in with everyone just to make sure that they can hear you clearly, because it's now going round and round and round. Hang on, just bear with me there. Yes, I've lost Dr. Karacan. Is everybody else with me? Is it just my internet, or has Dr. Karacan disappeared? What's happened? Guys, can you still see me? Hang on. IVF Turkey left. We lost Dr. Karacan. His internet gave up. Hang on, but we haven't given up on him. I'm getting him back in. It was bad, wasn't it? It wasn't just me. IVF Turkey, invite. Right, I've invited him here. The real Meg. Is it the real Mego? I love that. I'm here. He disappeared. Both internet, not that great. Oh, is mine bad too? I can hear you but not see you clearly. Okay. Do you know what? Let's try again. We can see and hear you. Okay. These are really awkward sometimes, aren't they? These Instagram lives. Oh, look, you're nice and clear now. Oh, yeah. Oh my God. Okay, you're really clear now.
So now we can continue.
Yeah. Nobody move.
Okay. Right. Great.
Do you know what is so lovely? We've got such really beautiful followers that really do care and stay with us. And I love that they're still here. Thank you all so much.
Wonderful.
So to recap, you were saying avoid alcohol, avoid cigarettes, try and use natural products if you can.
Exactly.
Okay. Right.
Exactly.
Okay. Somebody's just saying you're both very clear now. Yes. Okay. Brilliant. Now, actually, there was a question I just want to I just need to go back. Bear with. Oh God, have I missed it now? Oh yeah. What do you think? Okay, here's a word I don't know. What do you think about Neupogen wash before a frozen embryo transfer? What does that mean?
This is a chemical product and used in some cancer patients to stimulate cellular growth in bone marrow. So particularly if somebody uses chemotherapy and having low blood count, it's used to stimulate bone marrow to produce red blood cells. So this idea came from the use of this medication in different patients, but there's some studies which show the efficacy of this product used after intrauterine injection, and hoping this one stimulate endometrium, if particularly in patients who had thin endometrium in previous IVF attempt. But there are only a few studies showing the efficacy of this product, unfortunately. I can't say it's scientifically proven to use this one in women as a routine basis. However, yes, I accept that we have used this product in a few patients in the past who had thin endometrium. But I can't say this is effective on all patients experiencing thin endometrium previously. But it's a method still needs to be proven for routine use.
Okay. I'm going to read another one actually that was sent in earlier. I think it was yesterday. Please, can I ask why both mine and my partner's eggs mixed with donor sperm do not divide equally and slow down during day 1 to 3 in the lab? Out of 5 collections, we only got 1 frozen day 6, 3 double B blastocysts, which I am now worried about not working.
So as far as I understand, they mixed her eggs together with donor eggs, right?
With donor sperm.
With donor sperm. So basically, only 50% of eggs, so half of the eggs collected reach blastocyst stage. So this is a general rule. And of course, it depends on woman's age. This rate is valid for women at the age of less than 35. But if you are more than 35, this rate, blastocyst rate, per egg collected, goes down to 30, even 25%. So it's not a surprise to have like 4 embryos at the age of 34, 4 embryos out of 8 eggs reaching blastocyst stage. It's a common rate. But if the blastocyst rate, day 5 embryo rate, is lower than 50%, 40% in a young woman, it needs to be clarified, evaluated what the problem is. There may be some genetic disorder in women preventing her having high rate of blastocysts.
And just if anyone's watching and they don't actually know what a blastocyst is, because I certainly didn't before I started my first round, can you just explain what the blastocyst means?
Sure. As soon as we get the eggs, in 2 to 3 hours, embryologist injects sperm into the egg and keep them in an incubator. On the first day, they started dividing, and on the 3rd day, embryo reaches 8-cell stage, becomes 8-cell. 5 days after fertilization, so injection, in other words, after the injection of sperm, 5 days later, they form blastocysts, which is 200 is comprised of 200 cells. So it's kind of a stage in the development of embryo, which will reach 5 days after fertilization.
Yeah. But am I right in thinking that, but some days, sometimes an embryo is transferred after 3 days?
Right.
Because you hear that, because in fact, we just put something up on the website about that, the 3-day versus the 5-day. Why would you as a doctor go either 3 or 5?
Sure. The basic thought is that if a woman has more than 3 or 4 embryos on day 3, we keep incubating these embryos in the lab and keep these embryos for 5 days. But if we have only 2 embryos on day 3 or 1 embryo on day 3, we believe that there is no point in waiting any longer in the lab for this embryo to reach blastocyst stage. So it depends on the quality and the number of embryos on day 3. If we have limited number of embryos on day 3, we just transfer them, do not wait for 5 days. But there are some other centers that do not, never perform day 3 embryo transfer. So when you attend an IVF center, please counsel your doctor regarding the day of embryo transfer. You may want to wait for 5 days rather than 3 days to have these embryos transferred. But basically, if you have limited number of embryos on day 3, we just transfer them. Don't wait for 5 days.
Okay. All right then. Okay, here are some questions. What are your thoughts on, we've discussed this before. What are your thoughts on the ERA, the Emma, and the Alice test? She says she's having that next after 5 failed frozen embryo transfers with untested embryos. I'm 44. We have 2 blastocysts left and intend to transfer both after an ERA.
So her age is 44. Is that correct, Sarah?
Yeah.
Yeah. So these tests have been developed recently, but the outcomes or the benefits of these tests are still debatable, have been debatable, because not all studies came to same conclusion about the efficacy of these tests. We do not routinely offer these tests. These are very expensive and time-consuming tests, but I respect some other centers offering these tests to increase pregnancy rate. However, whatever we do, at the age of 44, pregnancy rate is about 5% because of the aged eggs, resulting in unfortunately low pregnancy rate. So I doubt if this method or one of these methods help her increase pregnancy rate. Unfortunately, I don't want to be pessimistic on the pregnancy rate, but rather than endometrial preparation, endometrial environment, egg is the main factor having failure.
Would you if she's 44, would you, she said 5 failed frozen embryo transferred with untested embryos, would you recommend PGT testing?
It's also debatable because PGD have some pros and cons. There are some false results of the PGD, and biopsy may harm the quality on the health of the embryos. In our practice, we don't routinely offer PGD in women over 40, 41. We just transfer the embryos, wait for the pregnancy test, because it's known that only 1 out of 12 eggs, is able to produce pregnancy in women over 42. In women over 42, 1 out of 12 eggs. So 90% of cases, I bet that these embryos will be chromosomally abnormal. The chances are very, very high having abnormal karyotypes in these embryos. The egg is a very important, factor to achieve pregnancy.
Well, I just want to send love to BabYBabble, and fingers crossed that these 2 blastocysts are the ones.
Hopefully, yes. Please, don't be discouraged by what I said, but just I'm giving you scientific data regarding the pregnancy rates in women over 42. Unfortunately, it's much lower compared to women less than 35. Yeah.
But I also, I always like to add at this point, don't I? I think I've said it so many times. I also just like to remind people that Tracy, that co-founder of IVFBabble, was in her very late 40s, and she is now the mother of twin IVF babies.
Wonderful.
So I always have to remind, she hates me talking about her age, but sometimes I think it's important. Okay, IVF with Care is saying, can low progesterone levels affect pregnancy test results after a frozen embryo transfer?
After the embryo transfer, we just need to check progesterone levels sometimes. It's not routinely performed, but it's advised that progesterone level is being checked 6 or 7 days or 5 days after the embryo transfer. In case of the presence of low progesterone, we increase the dose of progesterone to support endometrial lining. If somebody experiences multiple failed attempts in the past, we better check progesterone level in the luteal phase to adjust the use of progesterone or the route of progesterone to increase progesterone level in blood. But there are also some debates. It's not easy to conclude that yes, progesterone level should be checked, because progesterone level in blood may not reflect the progesterone level in the uterine environment, and there is no way to assess progesterone level in the uterine area correctly or precisely. So that's the conflict between groups claiming to assess progesterone or not assessing progesterone, not measuring progesterone in women having frozen embryo transfer. But to us, if women experience failed cycles, failed frozen embryo transfer in the past, she better have progesterone level assessed in the luteal phase in the new frozen embryo transfer cycle.
Okay, thank you for that one. What are the benefits of using Meriofert? I'm not sure what Meriofert is, for a second IVF cycle. I'm 36 and due to start my second cycle soon. What's Meriofat?
There are some different medications used to stimulate follicular growth. They are mainly produced of human urine, and there are some urine products and recombinant products. There are many names at the chemists and the pharmacy used to stimulate follicular growth. But so far, none of them has been found to be superior to others. So Meriofat is kind of urinary product, but urinary products are equal, if not, better to recombinant products. So I can't say that this product is better for her or worse for her. They are equally effective. That's the conclusion.
Okay. I'm going to ask a question that was sent in. Please, can you ask how much diet can influence an IVF cycle? And she's put in brackets, eating beetroot, cutting out sugar, etc.
Yeah.
Sorry, I put an eye.
So, of course, a regular or healthy diet is beneficial on all aspects of health, as reproductive health. So please, if you are willing to undergo an IVF cycle, try to be having a normal body mass index. So it helps you to get the best out of ovulation induction. It will certainly increase number of eggs collected at the end. So please stick to regular diet. It will increase your egg quality and egg number. And besides, don't forget, the eggs produced today have been started to growing in the body like almost 120 days ago. So if you are planning on going through IVF, you better pay attention to your diet and your body weight 3 to 4 months in advance.
Yes. Oh, yes. I've heard you advise that before, actually. Okay. You're a busy man today.
Don't worry. Don't worry.
Okay. Ronnie is saying, what can you do to prevent women of 43 years old having abnormal eggs?
To be honest with you, nothing can be, nothing has been proven to be effective, because eggs get older in the ovary, and there is no way as of 2023 to change the course or to change the health of the egg inside the ovary. So unfortunately, nothing to be proven. There are some studies over the use of PRP administration and some stem cell administration into ovaries, but there's still at the experimental stage. So we need to get more data to suggest or to recommend all these treatments in women having poor ovarian reserve or poor egg quality. So there are some studies, but I can't say this method will help you have a better egg quality. Unfortunately, no.
Well, actually, somebody also sent this in. Can you explain the difference between a good quality egg and a poor quality egg? I'm about to explore IVF, and I'm told that poor quality eggs don't turn into viable embryos. So what actually is a good?
So egg is formed. The core of the egg contains chromosomes, which combines with the chromosomes coming from sperm. So and as women get older, the chromosomal structure in the core of the cell gets vulnerable and unproductive and unable to connect with the sperm's chromosomal material. That makes the egg quality. So the chromosomes or the structure located in the core of the cell. And there is no way to prevent it. It is possible to change the cytoplasm, the fluid around the core, but it did not affect the pregnancy rate. We did it. We changed the cytoplasm of the cells coming from aged women, but it did not affect egg quality significantly. So the core carrying the chromosomes matters in having pregnancies. That is affected in poor quality eggs.
Right. And so, you know, so as you get older, then if the structure is not as good as it once was,
Right.
so am I right in saying then that you can't improve that structure?
Yes,
But
you can.
if you eat better, if you avoid all these, you know, toxins and whatever, you're not speeding up the sort of destruction of, if you like, of that structure.
Right. Yeah. At least you are helping your cells to get better, but you cannot change it significantly, drastically. But you might help them aging better or slower.
Yeah. Okay. I was saying, do what you can as well. You
Yes.
feel so better, don't you?
Yeah.
You've done everything.
Do your best. That's the motto. Do your best.
Okay, Leanne says, hello, Dr. Karacan. I had a successful frozen embryo transfer with a 4cc embryo, but sadly miscarried at 8 weeks. Oh, Leanne, I'm so sorry. How likely is it that my next round with the same grade embryo will result in the same outcome? That is tragic.
Yeah, I'm sorry for this loss. How old is she again, Sarah?
Leanne doesn't say how old she is. Leanne, let us know how old you are. That is
because that's what matters in the rate of miscarriage. In a woman at the age of 40, miscarriage rate is about 30% after pregnancy. At the age of 43, miscarriage rate is almost 60%, whereas miscarriage rate in a woman at the age of 30, miscarriage rate is 15 to 20% maximum. So rather than having this attempt being ended up miscarriage, woman's age plays the important role or gives us the best information on the success of the next attempt. So age matters now.
Yeah. I mean, hearing about a miscarriage at any stage of a pregnancy is heartbreaking.
Right.
But you think when you get to 8 weeks, you're almost at this like safe zone. It's, I really feel for Leanne. I really feel for you.
Yeah. In the first 8 weeks, miscarriage rate, again, at the age of 35, is about 15 to 20%. But after the 8th week, miscarriage rate drops down to 3%. Yeah. So it's a kind of limit, a threshold to have lower miscarriage rate. Yeah. After the 8th and 9th week, miscarriage rate drops down to 3%, particularly after the detection of fetal heartbeat.
Yeah. There's this one, I won't say who she is, but there's this one particular woman who's just had IVF. She's had her transfer. She's pregnant and she's about 8 weeks now. And I every single morning I wake up and I think of her. And I text her pretty much most days, just saying, sending good vibes, sending good vibes, sending good vibes, because it's just the most, like, it takes your breath away. It really takes your breath away.
It's a very difficult time to wait and to observe what's happening. I understand that. It's a tough time.
Yeah. Okay, right, now on to sperm. What can improve sperm morphology?
Particularly, morphology is determined by genetic material of man. So we can't do too much things on the health of or on the morphology of sperm. However, life habits, lifestyle is an important factor to affect sperm morphology. Sitting for a long time and increased heat in the testicles might harm the movement, motility of sperm and reduce the pregnancy rate. So I advise men to walk and not to sit for a long time, particularly drivers might have reduced sperm count. We have also observed this feature in drivers. So don't sit for a long time in the chair and don't use tight underwear causing increased heat in the testicles. That might help men have higher sperm count. normally, biologically, the temperature in testicles is 3 degrees colder than a normal body. So that's the natural area of testicles producing sperm. So if you increase the heat in the testicles, it might harm and affect morphology.
So should men be monitoring their bath water?
Yeah, yeah.
They should be measuring the temperature.
Right, they should be, and don't forget the heat is no good for sperm.
Yes. Right. Okay. I know it's past, but I'm just going to steal 5 minutes, only because we had a little internet dropout. Just 5 minutes.
No problem. No, I'll be with you.
Can having a bilateral salpingectomy affect your progesterone levels? Did I say that right?
Salpingectomy, I believe, right?
Yeah.
So I think she had bilateral salpingectomy. Yeah. And no, bilateral salpingectomy, unless ovaries are still there. So salpingectomy, as far as I understand, she implicates removal of the tubes. Then this method does not affect progesterone level in the luteal phase. No effect.
Okay. Ronnie is asking, is your clinic in Turkey or the UK? Turkey. But if people want to have IVF at your clinic or treatment at your clinic, they can do a lot of it in the UK, can't they? And then just come to you at the end.
Right. We have colleagues working in the UK, in London, so that they can contact her and provide some medication. This method will shorten their duration of your stay in Turkey.
Yeah. Okay. Actually, do you know Zuhal, who works for your...
Yes, who works with us.
She's done a brilliant article for us that you can find on IVFBabble, and it explains brilliantly just the kind of timeline of how it works and the time you spend in the UK and then the time you go to Turkey. It's really, really brilliant. So I would advise anyone to read that. Okay. Georginario, is that how you pronounce it? Says, I'm 43. Is it true that your chance increases the more rounds you go through? I'm about to go through my second round. I've had 2 miscarriages so far.
No, actually, no. The answer is no. The chances increases with the number of embryos transferred. So if we check cumulative pregnancy rate, so if you try like 4 or 5 times, having transferred like 5-6 embryos in total, of course the chances would be higher, but it doesn't mean that in the second or third round chances are higher than the first round. There is no rule like this.
Okay, all right then. And then just finally, there was one question, but it kind of related to what you were saying earlier.
Sure.
About perfumes and things, but this time it was about, do the laboratory staff laboratory staff wear perfumes and deodorants?
No, we do not. So it's not a good approach to use perfumes and stuff because of these chemicals being effective on the quality of embryo. So we don't use perfumes and any chemicals while working in the lab. So that's a good point. So we don't use it, unfortunately. We just use it after the work.
I was just going to say, do you go crazy when you go out? Do you?
Yes.
Okay, right. Just one more. I'll ask one more question from Sahira, who says, how can you overcome the chance of miscarriage after the success? I think, Sahira, what she means is how do you avoid miscarriage?
There's no way to avoid miscarriage completely. But after having 2 miscarriages, not 1, because all women might have 1 miscarriage in their lifetime. So after 2 miscarriages, we go ahead and do some tests to evaluate the reason of miscarriage, such as chromosome analysis, hysteroscopy to evaluate the uterine cavity, some immunological tests. So it needs to be evaluated. If a woman has 2 or more miscarriages, there are some tests to evaluate to find out the reason of this miscarriage. However, unfortunately, in only 10 to 15% of women, we are able to identify the reason of miscarriage. But in the almost 80% of women, it's kind of in the dark side why she had it. But we know that mainly it's due to chromosomal or genetical abnormalities which cannot be identified with some conventional tests.
Yeah. Okay, and just quickly, any guidance here? I'm looking to do IVF, but I'm single. What would your advice be? Do you treat a lot of single women?
No, actually, in Turkey, we are not able to provide donor sperm, but we send these couples to Cyprus to find a donor sperm. So in Turkey, it's prohibited by law.
Okay. I mentioned an account yesterday on a live Insta, but I'm going to say to Blessing Bieber, that's who's asking. Blessing Bieber, follow an account called The Stalk and I, because she's an amazing woman called Mel who has set, she is a single mother through IVF, and she's got this incredible website with loads of support and guidance. Right, I'm going to end it there. And I was going to say it's so unusual that we hadn't had a declaration of love, but sure enough, there is a declaration of love for you here. Where's it gone? Where's it gone? Yes, I had IVF done in 2022 by Dr. Karacan. He is amazing.
Thank you very much. I'm flattered. Thank you very much.
I love you for joining us today. And oh, Blessing Beaver, what's the account to follow? The Stalk and I. Direct message me if you can't find it, darling. Yeah, Dr. Karacan, thank you. Sorry we had a bit of, like a little bit of internet
No problem.
But,
no problem.
I adore you, and as always, thank you.
It's a pleasure to be with you, so we'll meet again.
Definitely. Give
bye-bye.
love to everyone.
Bye. I will. Bye-bye.